As you can see, I think you're in your kitchen and I'm hiding in a bedroom at the moment. So I suppose that's a good lead into what we're going to talk about. So we're going to talk about the implications of working from home, musculoskeletal, bone, muscle health and things like that. But I suppose that the first thing to do, Kaz, is to find a little bit more about yourself and Strength for Life, and then we'll lead into some questions. Is that okay?
That's fine, yeah. So I'm Kaz. I work in the NHS at the minute as a physiotherapist. That's what I'm employed as full time. During the kind of COVID pandemic, I got sent towards the hospital wards where I've been working kind of quite closely with a lot of people that have been infected by that kind of the illness and stuff. But in my kind of evening and my weekends, I work as with a company called Strength for Life. We do a lot of workplace health stuff where I've worked with Andy quite a bit. We run a strength training class at Sheffield Hallam University, and then we run a lot of CPD training for exercise-based professionals to come and learn about strength training. We absolutely love it, really passionate about it. So trying to teach as much people as I can about the importance of strength training and why it's important. So I think that's what we'll be kind of talking about today, isn't it, Andy?
Absolutely. So, and just tell us a little bit about your team as well. So I know you work with Chris, who I know, and various professors.
Yeah. So myself and Chris Hattersley, who are both qualified strength and conditioning coaches and physiotherapists. So we work very closely. I've also got great links to Sheffield Hallam University. We've got Dave Hembrough and Tom Maiden-Wilkinson, who both work at the university, but involved in just numerous projects around strength training, particularly in Sheffield. I think Sheffield's really quite good, South Yorkshire generally, quite a lot of good stuff going on in terms of strength training. So it's becoming a bit of a hub, Sheffield, really, for this kind of research and this kind of, I suppose, ideology, really, of using strength training for health and stuff. So hopefully if we can make this the hub and then get it out in the country a bit more nationally, and I think it's all, generally quite good, positive stuff that's going on at the minute.
So Sheffield's the hub of the UK.
We did this thing where we wanted to make Sheffield the strongest city in Europe. I wasn't sure what the actual criteria was, but I thought it sounded nice. I think off the back of the Tour de Yorkshire and things like that, I think there's just loads of great stuff going on, isn't there, around locally for us? So it's we're very lucky, aren't we, really, to be where we're from.
The City of Steel. And of course, we've got Move More there as well. We've got to mention Move More as well, which is the ambition to become the most active city in the UK. So there's lots going on. So I suppose leading on to implications of sedentary and sitting time for workers that are working from home, although there's a lot of people apparently that are cycling more and walking, which is brilliant. You just tell us what is MSK, the musculoskeletal. If you just tell us a little bit of what this MSK thing is we're all talking about.
Yes, I think a lot of people hear the term MSK, the abbreviation, bounded around, but they're not always quite sure what it means. Musculoskeletal tissue is basically, I just say, bone, muscle, tendon, your ligaments, all that kind of stuff that comprises the human body. It's particularly prone to a few kind of ailments and pathologies and things like that. Achy pains, basically, achy knees, neck, back pain. You have fractures, muscle strains, tears, all that kind of stuff are typical kind of MSK injuries. And as a physiotherapist, we can specialize in a few areas, and one of those is MSK related conditions and problems, and that's kind of what I do. I'm certainly kind of quite involved in looking at that and see a lot of people with like back pain, your neck pain, arthritic knees and changes, things like osteoporosis and bone related kind of conditions, which are all quite common. I think people recognize those terms when you mention them. But again, we talk about what's been going on with the pandemic and people working from home. I think people have been pushed into being a little bit more sedentary in terms of their typical daily kind of routine. And again, you'll notice an increase in MSK related conditions. And I think working with the physios in the hospital who are still in the teams that work with people that have been affected by those, they are seeing a bit of an increase. People are noticing like their achy pains kind of popping up again because people aren't moving as much. And I think that's kind of just generally what's been going on, isn't it? People are forced to generally not being able to move around as much. So I think that's going to have a few problems long term, but hopefully we can kind of combat that with good quality advice and things like that, a bit of education.
And I think you touched on some good points there in terms of the daily routine and even commuting to work as an element of moving that you haven't got when you're migrating from your bedroom to your living room or your office, which might be 10 steps as opposed to getting in and out of a car, or if you're active, it could be on a bike, walking, whatever. So yeah, there's a lot of things to think about.
Yeah, I think it's been really interesting as a kind of to kind of watch the whole pandemic and the lockdown unfold. And I remember when it kind of all first started to kind of kick off, and we were only allowed out once a day to exercise. And interestingly, I saw a lot of people that wouldn't normally exercise really embracing that once a day trip out, whether it was just a bit of basic walking. I know to people that we're not really walkers and we're quite sedentary at home. Suddenly, when you're only allowed out once a day, the perspective changes. And I think I noticed a lot of people going out walking, people were dusting off their old mountain bikes. I know you love your cycling, getting out in the peaks and things like that and going around doing stuff. A lot of people took up cardio because it's generally quite easy to go and pursue, isn't it? Things like jogging, you just need a pair of trainers, just get them on and get out there. So I think it was interesting to kind of watch that. But with the gyms closing, I think it became very hard to do strength training. So I think while people probably going out there enjoying cardiovascular, which is great exercise, need to be doing that, got to have a strong cardiovascular system, I think strength training is a lot harder to do. I mean, I've been strength training personally for over 10 years. I imagine you've been, a long time. It is difficult, isn't it, when the gym's closed down and you've got your routine of going there, going to the gym, going home, doing it, and then suddenly that's taken away from you. It becomes really, really tricky to kind of pursue it. So I do really genuinely feel for people that are having a bit of a hard time at the minute with the strength training.
Absolutely, and we'll touch on some of that as well, and some of the basics of exercise and strength training. I think we'll cover that. So I suppose in your job role at the hospital, in terms of being a physio, what's the sort of most common MSK issues you see coming in? I suppose obviously it can be very varied.
Yeah, it's very varied. I've seen a lot of back pain, a lot of shoulder injuries and shoulder pains. Guys like quite manual trades, things like plasterers and your joiners, people that are always kind of up here with their arms and working. Quite a lot of back pain, and then you've got your knee arthritic changes, all that kind of stuff that is very common. Every so often you'll see something slightly more complex, but the vast majority of stuff is just your quite kind of basic achy kind of joints, really, which are a number of different reasons why they can pop up and kind of occur, and they can be really quite troublesome for a lot of people. It can really kind of bother people and annoy people, and it can really kind of grate on people a little bit. So it's really quite important that we give like good quality advice and get them on the right track and get them moving forward. So again, it's going to be quite interesting to see the aftermath of the lockdown and the pandemic and how that's impacted health away from COVID. I think right now the focus is on COVID and the death tolls and the kind of symptoms that people are experiencing, but there's knock-on implications, isn't there? The lockdown is going to have effects on other people's health, whether that be physical or mental health, like you touched on earlier.
Yeah, so that leads into a really good one as well. So in terms of if we're looking at predominantly sit-down workforces or workforces that were traditionally had a bit more movement in, but of course a large majority of the staff population are working from home, how bad is sitting for the musculoskeletal system for long periods of time being inactive? What sort of changes take place?
Yeah, it can be really problematic. I think the human body, I mean, I don't pretend to have all the answers, but the way I see it, the human body is just designed to move. We've got this great vessel, this great instrument that can bend and twist and reach and do all this cool stuff. And then a lot of the kind of office-based, certainly, where workforces are sat down for just huge amounts of time. If you add your commute into that, if you're driving or if you're sat down kind of commuting, it can become, like 7, 8, 9 hours in some cases of people being sat fixed in one position. The big thing that happens is what we call deconditioning. So the muscles just start to weaken, the musculoskeletal tissue, whether that be your muscles, bones, ligaments, tendons, all that stuff, just generally kind of weakens down a little bit and just makes it a little bit more prone to injury. That's kind of how I explain it to people. Again, things like step count, I know you're quite big into being active and kind of getting your step count up, is just another way to kind of directly address that and give you an objective measure almost. I like to check my iPhone does it for me now, measures my steps. It does everything, this iPhone. But I like to kind of look at the numbers and think, actually, was today an active day? Was I quite kind of sedentary? And kind of use that as to give me kind of some objective feedback. But it's muscle weakening, been fixed in one position, not moving, is just going to cause that body to weaken, and the increase of musculoskeletal related injuries and illnesses and pathologies is going to increase basically with that kind of sedentary behavior. So,
I mean, it's interesting as people can see here, I'm stood up looking down at a laptop. I'm stood up, moving about. But I suppose this is the reality of working from home. So you touched on a few things there, which might be exposure levels to periods of time in one position, and whether that's been a mechanic looking up at a ramp or sitting down looking at a laptop for like you said 9 hours, which is more than the equivalent flight to New York. When you're looking at, you're going on a flight to New York and beyond every day by sitting, and I certainly dread long haul flights for that very reason. Oh, it's interesting. So it seems movement's pretty key. So I really want to touch on strength training, because people are aware of the cardio benefits, the 10,000 steps, the 30 minutes a day, 5 times a week. But I'm really interested in your expertise in terms of strength. So I don't want to turn it into a debate on cardio versus strength, because they both have benefits, but there's some very specific benefits of strength training that you don't get from cardio. Could you expand on those a bit?
Yeah, I mean, yes, like you just touched on, really important to do both of those things, isn't it? You want a good cardiovascular system and you want a strong MSK system. There's so many benefits to strength training that I sometimes think people think I'm making it up when I start going into it. Again, just a stronger, more resilient body. How I describe it to my patients when they maybe sat on the fence a little bit, maybe haven't quite got the buy-in, is I'll talk about what I call the strength bank account. And it's just a nice simple analogy, and I find the penny usually drops when I mention this. I'll say, think of your strength levels like a bank account. Okay, the more you put in via strength training, the more you can kind of deposit, the more you can afford to kind of cash out should you have any kind of illness or injury or something happen to you. Your strength reserves are just a bit bigger, and you're going to be much more resilient. You're going to handle whatever life kind of throws at you. You know better than anybody, life can throw all sorts of things at you. You can be doing everything right and unfortunately develop some kind of injury. If your body's nice and strong to begin with, you're going to handle that stuff much more easily. So that's the main thing. But then on the underside of that, pretty much every major condition that affects different body system, whether that's neurological problems or breathing problems or all these kind of unusual conditions that can kind of pop up, a lot of them you can use strength training as a really kind of good treatment measure or a preventative health measure. Okay, so it goes some way to kind of helping you prevent the more kind of complicated stuff. Okay, there's some stuff that's congenital or stuff that comes in that you really can't do much about, but if you're nice and strong to begin with, you're going to handle those health problems in just such a more appropriate way. Things like body composition as well. Strength training is a great way to keep your weight down, keep your body fat down, keep your muscle mass nice and high, which is kind of what we want. That's a good, strong, healthy person. And then underneath all that, all the metabolic kind of blood pressure related stuff, just general heart rate levels and things like that are going to be massively influenced by strength training. So it affects the body in such a positive way across so many different systems that it's just, you can't afford not to be doing it. Basically, it's absolutely brilliant. I could talk about the benefits all day. It affects literally every different piece of tissue in your body, so it's absolutely fantastic.
And in terms of things like that, so we've heard a lot about this moving as medicine, which a lot of clinicians are looking at. So indeed, strength could be prescribed. Now, I'm presuming with what you do, you're a bit of an innovator in this space with Chris and Strength of Life. Is using strength to help rehab people, to help people prepare for future illnesses, and reducing the chance of things coming back that affect the MSK system. Tell us a bit more about that.
Yeah, exactly. Building up those strength reserves is all we do. We want to get people nice and strong, nice and resilient, so that they can handle different things. I work with a lot of people that have like what we call long-term conditions, where their diagnosis is probably not going to go away. It's going to stay with them for the rest of their life. I work with a lot of people with like quite complicated breathing problems or conditions that affect the brain and things like that, which unfortunately probably aren't going to go away. They're going to be with there for the person for life. But actually, if we make them nice and strong and they've got plenty of reserve and they can manage on and off a chair, in and out of bed, they can walk around, they can go for long walks, they can bend down, pick the grandkids up or the kids, etc. They can do all that stuff that they want to do in life. And that it creates a real good quality of life for that person. So sometimes it's not about preventing the illnesses, it's more about helping people have the tools to manage them and to kind of be able to do all the things they want to do in life. I love that. I love listening to people, like you, like working with people, like listening to what people enjoy doing. You get some crazy hobbies and things like that. And if we can get people doing what they want to do for longer, that's great. I don't want to turn everybody into a power lifter or I know you love your strongman training. I'm not trying to turn everybody into Jeff Capes or anything like that. I'm just trying to get people doing what they like to do for longer. And I think strength training is the best way to do that. And I think if you put that to people and say, look, okay, I'm at, strength training might, if you're not really 100% really into it, but you can feel like you can do it, just twice a week is enough to really get those benefits to keep you doing the things that you do really love doing. And I think when people kind of feel it like that, they think, okay, it kind of makes a bit more sense to me. So that's kind of what we're aiming to do. Strength reserves up, quality of life up, just general engagement and the things you want to do across a day is definitely a positive thing.
And you leaded me on some more questions. For those listening, watching this, we have got about 12 questions, but I knew we'd digress. I think once me and Kaz start chatting, we could just go off on one. He's leading me into other questions here. So I think you've touched on an important point there about strength being functional in terms of the practicalities of everyday life. So you mentioned, for example, people that might have grandkids and it might be lifting those grandchildren into the back of the car in a car seat, which is quite taxing for anybody. Let's be honest when you're stretching over. So strength has got some real practical benefits as well in terms of maintaining those strength and allowing you to continue in everyday life.
Yeah, so basically strength underpins pretty much everything you do in a day, okay? All your movement is underpinned by a certain degree of muscular strength. I could take you on the wards now. I know you work in a hospital now, Andy, so you've probably seen it yourself, but patients that are, really quite physically deconditioned and weak, that would not be able to get on and off a chair themselves, or would not be able to certainly get in and out of bed or on and off a toilet, or because it's basically on and off a chair is a bit like a squat, isn't it? It's the same kind of movement, the same kind of muscles that are used. So when muscles weaken to such a point where people are no longer able to physically move or do the things that they need to be able to do in a day, again, it puts a bit more on the family, doesn't it? Family, carers, social services need to kind of get involved to help that person to live, basically. So one of the things we like to do is use strength training as a way to kind of keep people ticking over and doing their own thing, keep people independent in a lot of cases. And with the workplace health stuff that we do, and obviously work quite closely with you in the past, a lot of the time, if we can get people at ages 30, 40, 50, 60, those kind of ages, it will massively influence the decades that come kind of prior to that. So again, if we can get people starting nice and early, getting them nice and strong, building that strength bank account and boosting those physiological reserves, they're just going to age much, much, much better. And that's what we want, don't we? We work all your life. When you retire, you want to go and enjoy and do the things that you want to do, and you want your health to be there. So that's what I try and do, is get people to strength train sooner rather than later. But there's no age limit or anything like that. You start whenever, basically. My oldest patient, 104 years old, never done any training before. Winnie the Winner, she was called, absolutely lovely woman. She goes around doing talks in schools and all sorts, and at 104, getting on with it, having a go, doing some kettlebell stuff, absolutely love it. So there's no age limit, unfortunately. We can always get the strength training done.
So I think that's brilliant. You've just quashed the barrier, which is I'm too old, and it's thinking long term into, I think, for the gym and weight training has always been seen as, it's you're wanting that beach body or the six pack and everything else, but actually strength training has got so many different benefits. You've talked about metabolic things. I know there's links with dementia and things like that, the benefit, and managing conditions and all. So it's absolutely massive. So let's focus on this natural process that we all go through as we age, in terms of how strength drops off and how the impact of being sedentary actually can accelerate that process and bring us into those sort of problems. So if I just share this one screen, don't know if that's come on. If you just tell me, Kaz.
Hold on. So it's not come on now. It's a black screen now.
It should come on soon. With a bit of luck. So has it come on yet?
No.
What I'm going to do is I'm just going to cancel this screen share. I'm going to try it once more, and if not, I'm sure that we're more than capable of talking through it, but it's just a nice visual, I think. So we'll just try sharing it again.
There we go. Yeah, that's all. So this is actually a slide that's taken from some of the stuff that we do in relation to workplace health, or our workshop that we run at Sheffield Hallam University. And the graph basically explains it quite nicely. So you've got strength going up one side, age going across the other. And basically if you look at the top line that says strength training and then the arrow, that denotes a kind of strength trained individual. So as you'll notice, their strength levels increase quite rapidly through their early life. They get to like adolescence and kind of early adulthood, and the strength levels will start to taper, because generally speaking, that's when somebody is going to be physiologically at their strongest. If you think about things like athletes and stuff, they're usually of a certain age category, although there's some people that will come and completely sort of knock that out the window. And the strength trained individual is doing, let's say, regular strength training twice a week, like what we advise, and in line with the government guidelines. And his strength levels will slowly taper through adult life. And as he gets to kind of older adult life, 65 plus, going into 70s and 80s, the strength levels will just follow a natural kind of decline. The bottom line with the red arrow that says 45 years old denotes an unstrength trained individual. So somebody that's maybe quite sedentary, not really exercising regularly, certainly not doing any strength training. Maybe they're not, eating very well either. Their strength levels are going to be much lower than the strength trained individual. And it starts young. It starts in school. We've got a real problem in this country of real kind of sedentary, young children, and the obesity epidemic that we're kind of going through, which is really going to have quite profound effects on people's health. I don't think people always realize that. So the bottom, the unstrength trained individual hits a much lower peak. But when they get to about 45 years old to kind of 50, that was the magic number that kept coming up in a lot of the literature as being the age where strength levels start to really kind of taper off and decrease. And I think sometimes when we do the workplace health and we're talking to the crowds, and I mentioned the age 45, and then people start going, oh my God, that's, they start whispering, oh my God, that's me, that I'm approaching that, or I'm there kind of thing. So happens a bit earlier than what people think. And I think people don't necessarily realize that their strength levels are decreasing unless they actually get their strength tested, or they go, like you're saying, we're picking up your grandkids and heavy kids. They don't realize till they go and do something like that and they can't do it, or they do it and they get a little bit, get a bit achy or something, and they think, God, I used to be able to do that and now I can't, because it's covert. It's happening in the background. Your strength levels, you don't wake up one day and they've just gone. It's happening every week, every day for decades. So it's kind of happening in the background. You're not always seeing it. So if you look at that bottom line, so as the strength levels taper off quite quickly in the in the unstrength trained individual, you run the risk of hitting what we call that disability threshold, which is that red box at the bottom. And that's exactly what I was mentioning previously. That's when your strength levels have dropped so low that you are now physically struggling. You're struggling to do your day-to-day things. All the stuff that you need to do in a day is becoming problematic. Things like MSK-related injuries and illnesses and other kind of comorbidities and health problems can kind of start rising up. And unfortunately, when people are in that disability threshold, it can be quite tricky to get them out. So that's why we do so much in terms of preventative healthcare. We're trying to stop people getting to that level. That's when I do the workplace health, and I go into businesses and offices and different organizations, and I tell people, look, I'd rather see you now as a strength and conditioning coach and get you doing some exercise than I would in 10, 15 years as a physio trying to reverse a condition that's maybe a bit too far gone or going to kind of always be with you. So that's kind of the idea behind it, and I think that graph shows it up nicely. A couple of stats on the left hand side. I mean, the top one is mentioning the major ages where things start to drop off. So 45, 65, 80 are like checkpoints that can kind of that we do start to notice strength decreasing, but everybody's different and that can be quite subjective. The bottom one, 50% of the physical decline associated with aging is actually disuse atrophy due to being inactive. So what we consider to be normal, quote unquote normal weakening and just getting a bit older, it's not normal at all. It's down to not using your body, and we can treat that with strength training. So that's, again, I think sometimes people think it's normal to just get really weak as you get older and not be able to manage these things, and it's really not. I mean, I'm sure you've seen the videos on the internet of you get some like 80, 90-year-old fisherman somewhere in the Philippines that's really trim, and he still does 10,000 steps a day, and he's lifting and hoiking things. And I just think, why don't we make that the new normal? Why is that not, that's not considered the normal, I think, currently in the UK. Hundreds of thousands of hospital admissions because of conditions that affect the musculoskeletal system and weakness related. And the last point at the bottom I mentioned previously, but it's covert. It happens over many years. You might not start realizing that your body's weakening and becoming a bit more frail. So again, get in early with the strength training. Try and get yourself on that top line and make your strength levels drop off nice and slowly, as opposed to quite dramatically.
Yeah, and that covert thing, I'll just stop sharing that. It's really interesting, isn't it? Because it's a bit like weight gain. It's accumulative. It sneaks up. You know, as we all do, and I'm not immune to this, even being in the role that I am. You know, I'm not some sort of robot. Neither are you. You have to keep chipping away. But I suppose we've got some of the advantage of some of the education you've shared, and I think what puts you, Kaz, in a really unique position is you've got the strength and conditioning expertise, but you're also 10 years down the line treating people, and I think that gives you a sort of you know, it really gives you an insight into the effects of not strength training at the other end. I think that's brilliant. I think that's why Strength for Life works really well. So a little bit of a plug for you there, really. But I could listen to you all. I mean, I've listened to a lot of your presentations similar to this. I could listen to it all the time. I think it's brilliant. So let's, if we're refocusing back onto back pain, for example. I'm using back pain because it's a common, you know, mid back's hurting and stuff like that, but it could be many things. It could be a repetitive strain injury or anything. So in terms of strength and conditioning and either managing a current back problem, and I know I'm not asking you to give clinical advice without assessing somebody properly, but these are just general sound bites, or actually you're aware that you don't want to run into back problems. What are some of the key strength exercises you can do, bearing in mind a lot of us haven't got access to the gyms just yet at home, and what could you use and adapt for some core exercises?
Yeah, I think it's really tricky at the minute, like you mentioned, with the gyms being closed. And generally, if you look online at the minute, I mean, the cost of the home workout kit is really quite expensive at the minute. I'm
glad you mentioned that.
It's ridiculous. I mean, I've got a small kettlebell at home, only an 8 kilogram, which is quite light for myself. You know, and I'm having to get really creative. I mean, I've really struggled during this lockdown. I was really quite well into the training before the lockdown. Unfortunately, with the way things are, I've not been able to access the gyms. I've not been able to access the really heavy weights, and I've noticed my muscle mass has decreased. It's gone down, and I'm okay with that. I've accepted that. That's fine. It'll come back when everything returns to normal. I'm not beating myself up or stressing myself out thinking about it. But I've had to get really creative. So for me, I've got that small kettlebell, but I've seen people. I mean, the classic stuff that probably you were doing when you were younger and your dad was doing, press ups, body weight, squats, all that stuff is still really, really useful. Body weight exercise is absolutely brilliant. I've got people doing like half press ups. I've got people doing wall press ups. I've got people doing air squats. I've got people doing all that kind of classic stuff, which is it's still really good. And again, it's something is always better than nothing. Okay, and it's really tricky. I've seen people fill up rucksacks with tins and household goods and create a little bit of weight that way. I'm really lucky. There's a nice tree outside my apartment with a beautiful branch, nice and straight.
I'm jealous. I've been looking for one locally.
When you get one, you've got to mark it on Google Maps, and then you've got to not tell anybody. And I found a tree branch, and I've been doing pull-ups and press-ups and little supersets and just whatever I can do to keep myself ticking over. I've been in this game a long time. I've been over 10 years of doing proper strength training. And even it can be tricky for me. I think I'm probably in a better position because I know how to maybe get a little bit creative and work in resources that maybe don't have a lot of equipment and things like that. But it is generally quite tricky. But again, I think it's just something is better than nothing. If you're thinking right now, I want to do a little bit of strength training, but I'm not sure how to do it. Start simple, things like body weight, squats, little half press ups or wall press ups or full press ups if you think you can. All that stuff is really, really good. I mean, get on YouTube and have a look at things on there. There's loads of stuff on there that can give you some ideas. I've seen people buy, like the resistance bands, which, they're not, they've certainly got their place in strength training. We use them clinically. I try not to use them all the time, but I like to use them in particularly environments like this where you've not really got much. Those resistance bands can be really good. I've seen people use tea towels and just pulling them and doing like more isometric static kind of stuff. Whatever you can do to get those muscles working is always better than not doing anything and being sedentary. So it's really, really tricky. Don't beat yourself up about it, basically. Try and keep yourself ticking over as best you can. And I imagine when the gyms do reopen and the facilities do kind of open back up, I think a lot of people now are really missing it and I think really want to get back into it. So I think it'll be a positive thing, this lockdown. I think we've gone through a traumatic unusual, difficult experience, but coming out the other end of it, hopefully, as things start to slowly return to normal, it'd be nice to see more people get into the strength training and try and embrace it a little bit after, you know, a time away from it, 2 or 3 months away from it.
So in terms of if I'm, you know, watching this podcast and thinking, you know what, I'm going to give this a go, and we are limited at the moment, there's no doubt about that, without some equipment, but still you can do a lot with minimal equipment, which is what I want to concentrate on. So I suppose it's a two-pronged question, this. So if I were to look and think, right, you know, I want to do some strength training, we're probably going to be looking at big muscle groups. So I'm guessing your squats, your hamstrings and your glutes, and so you might maybe want to activate them. And when you are loading up muscle, whether that's squatting or using bands, or if you're lucky enough to have some equipment, kettlebells, or being creative, what actually happens in the bone, for example, when you load that up with weight? Because that's a really key point.
Yes, I think a lot of people are always quite surprised, especially the people I work with. A lot of people that get things like osteopenia and osteoporosis, which are conditions related to your bone mineral density. And people don't realize when you load up the muscle is connected via a piece of tendon to the bone. So the force that goes through the muscle then goes through the tendon, which then goes through the bone and strengthens everything up. Now, unfortunately, if the weights that you're using are really, really light for you, okay, because remember, everybody's different. What might be light for me might be really, really heavy for somebody else, and vice versa. If the weights are not enough to kind of give you what you need, the stimulus, it'll go through the muscle, but it never really gets to the tendon. It never really gets to the bone, and things start to weaken off. I work with a lot of ladies, unfortunately, who are particularly high risk, particularly kind of going through menopausal changes, that they've got various hormonal things that can be going on, which create a kind of catalyst for bone related conditions. And I get, you know, a typical kind of a demographic is like sometimes really quite slim, do maybe a lot of yoga, Pilates, so really quite trim ladies and stuff. And then they fall and they maybe have like quite a bad break, and they have a bone scan and they realize, oh, my bone mineral density is quite low. And they're really confused by that, because they think, well, I'm doing loads of walking, dog walking, I do loads of yoga and exercise and all this kind of stuff. Why are my bones really, really weak? And it's because the missing ingredient was the strength training. We weren't strength training and loading up the bones and the tissue to the right kind of threshold. So whilst cardiovascular system's great, body composition's great, mental, physical health generally okay, maybe the strength component is missing. And I like using that example of people because they're really, really shocked by it. Whereas I think people that are generally not doing anything maybe are a bit more receptive to the fact that they might have a health problem. But think about that demographic. If strength training is missing, the musculoskeletal system will decondition and will suffer as a result. There's very few people, you're talking maybe less than 1% of the population, that will get the necessary threshold of strength training from what they're doing from physical working. Things like your farmers, your really kind of heavy industrial jobs, strength levels are generally quite strong with those guys. I mean, some of those guys are tough as old boots, but the vast majority of the population, they're just not going to be getting that kind of threshold from the work that they're doing. And it can be really tricky, I think to kind of push, if you're new to strength training, it can feel a little bit like, well, how hard do I push myself? How hard do I go? What's enough? What's not enough? And that can be really tricky. And I think that's where having a trained eye, I mean, there's loads of great personal trainers and people that are working online. And if you're thinking, I just need a little bit of advice or a little bit of a push forward, get yourself looking at a good quality registered personal trainer to give you a little bit of advice and assess maybe your personal needs, where your weaknesses are, and they'll give you a bit of a program to kind of work towards it if you feel like you need it. It's a great investment in your health. I'm a real big believer in things like that. So again, just a few things that you can be doing really to keep yourself nice and healthy.
So we could be walking more, we could be getting the cardio in, but then loading up the bones and the musculoskeletal system using strength has specific benefits, especially for what I said, which leads on to my next question, but you've already answered it. This is why it's good. It's just a natural conversation. It was flowing all over, which was the women and gym. Again, historically, there's always going to be misconception. You know, go to the gym because you want to be massive and it's for blokes. And I know you've used the example of some gyms separating the women's area with really minimal equipment, and the men have got their own area, when actually the whole gym and the whole range of exercises that men can do equally benefit women as much as, if not more so, during these life changes, especially osteoporosis and bone density. So
I think really interesting to look at, like in the 1990s, 1980s kind of thing, going into the 2000s. I think a lot of people that were really into the strength stuff, it was more your bodybuilding types. It was more, strength was certainly on the fringes. You watch like The World's Strongest Man, and it was almost these like superhumans doing things that was almost like a spectator exhibitionist kind of sport. But now I think particularly weightlifting it's gone mainstream. I mean, I spend my life in loads of different gyms and stuff, and I'm absolutely amazed at. Sometimes I'm walking in and seeing loads of ladies in the weight area, which is what we want. That's exactly what we want. You know, your young lads, early, 20s and stuff. You see them all in the gyms getting the body ready for the holidays and all that kind of stuff. That's great, okay. But those people, statistically, they're the least likely to need strength training, okay? What we need is more kind of, we need certainly more women, more people with disabilities, more people with the health problems getting in there and doing the strength training, which is kind of what I want to see, a bit more diversity. Again, people from ethnic minorities, which unfortunately really, really underrepresented in strength training. Again, the numbers are really quite low. So that's what we're trying to do at Strength for Life, is get the people that don't normally go to gyms or don't normally strength train to get involved. You hit the nail on the head perfectly. Basically, yeah, ladies that I've seen, unfortunately, a few gyms where they've got a ladies only section, and then you go in and there's only, the weights don't really go that high, or it's all kind of your yoga mats and your more kind of your kind of softer quote unquote exercise, which I think is a real shame. But then you got people like Jenny Tong, who's a weightlifter from Sheffield, who does a lot for kind of ladies training. I think she's a perfect example of someone that's just got in there, got into the strength training and really kind of owned it. So hopefully that kind of causes a bit of a ripple effect. More ladies feel confident doing it. I think that the tides are slowly changing now. People are getting more into it. People that would have never dreamed of going to a gym maybe 10 years ago are now in there training, getting on with it. I just think it's a real kind of positive, proactive thing. So yeah, really happy about that.
And Jenny's a really good example, isn't she? Because a lot of people associate, gym where you're going to get rippling muscles, and as a woman you might be worried that you're going to get bigger. Well, if it was that easy, all men would be doing it. Well, they're going to get absolutely massive. But when you look at, and I'm not ashamed to say this, when you look at some of the weights that, and of course Jenny's an athlete as well. She does a lot of this. When you look at her body weight, and I don't know what it is, but it's light, and you look at some of the weight she's shifted, far above mine. Unbelievable, unbelievable for the body weight. It's a bit like an ant, isn't it? When you look at an ant and it lifts so many times. I look and I think, wow, that's impressive. So again, it's accessible, it's inclusive for everybody. So I suppose, in conclusion, in terms of strength, to wrap this up, we've covered a lot, and I love it. In terms of the very basics of strength training, I'm sure we can post some examples, or you could send maybe a few YouTube videos of things that you recommend, or charts. I know we have done before, haven't we, over the years, of some chair-based exercise, for example, that might help. And that might just give some people a starting point to do at home. Then when gyms open or there's more equipment available, people can adapt and see that progression. So just give us a roundup of what you could do right now, working from home or working on site somewhere, and trying to fit physical activity. You want to strength train, you've seen the benefits, and also why strength training can prevent future problems such as back. And I'm just going to use back because it's something that I get all the time.
Yeah, I mean, I think my typical advice I would give to a patient is, let's say, try and keep your general physical activity across the course of a day as high as what you feel you're able to, okay? Things like step count, objective measures like that give you a number, a reading, are really useful, because it gives you some way of quantifying how much you've done in a day. 10,000 steps is seen as kind of being the gold standard. For some people, that's going to be quite achievable. I do, with the job I've got, and I imagine the job you do, you're well over 10,000 steps. For some people, that's going to be really, really hard. What I would say is, my first piece of advice is always just measure what a typical week is for you, what is normal based on what you're doing currently, and then incrementally increase that step count, okay? Things like trying to get rid of using the lifts and using stairs and things like that, that's really good background physical activity. And if people are doing that, that's already a great start. If somebody's doing that, and they're really simple to do, okay? If you're working from home, it's about trying to avoid being sat sedentary in one fixed position for long periods of time, and try and keep your step count nice and high. That's absolutely great. That's what we want people to be doing. Then what I tell people is, ideally you want to be doing at least 2 strength training sessions a week. Now, people think that has to go on for hours. They really don't. You can be done in 25 minutes. If you're training on your own and you're just going in focused, it doesn't have to take any longer than half an hour, okay? So 2 half-an-hour strength trainings at the opposite end of your week, like, because there's a 48-hour kind of carryover of all the benefits and all the good stuff that's happening around the body, affecting all the different systems. So if you had 2 strength training sessions at the opposite end of your week, in theory, you're covered. You allow yourself a bit of recovery time, all that kind of stuff. And then on top of that, it's your cardiovascular stuff. It's whatever you enjoy doing. If it's cycling, running, jogging, all that kind of stuff to keep the heart health ticking over. What I think I see a lot of is people doing lots of cardio, but maybe not doing the physical activity during the day and maybe not doing the strength training. If you hit all those 3 boxes, that's a very well-rounded, healthy kind of regime, really. And it's really not that difficult if you slowly, incrementally build yourself there. It's hard when you've got family and care responsibilities and work, and then you've got the backdrop of the lockdown and everything's just a bit strange at the minute. You're allowed to kind of fall off the bandwagon as long as you kind of get back on there, or you're allowed to get on the bandwagon for the first time now. Now's the perfect time to start. You've come out of a really strange situation. Let's get doing something, basically. So keep your step count nice and high. Try avoiding using those lifts. Try and use the stairs. Just general physical activity. Avoid being sat for long periods. That's great as a background. Your 2 times a week strength training, if you feel you can go for that, or slowly maybe start with 1 session, build your way up to 2 and kind of start with there. And then your cardiovascular exercise on top of that. That for me as a physio and a strength and conditioning coach, I'm absolutely buzzing if people are doing that.
Well, thanks for your time, Kaz. That's been brilliant. I hope people that are listening or watching this have got a lot from it. And those key messages at the end, moving more, breaking up sitting periods, I think are absolutely key. And indeed, I hope that Kaz has somewhat, sort of got rid of some of the misconceptions of what strength actually is and the way it can be used for everybody in terms of treating or preventing a range of conditions. So thank you for your time, Kaz.
No problem.
I'm sure we'll be working together soon at some point in the future anyway.
Yeah, certainly. Just a final message. I mean, again, we're active on the social media. If you've got any questions off the back of this, or you think just would quite like them to go over that again, or I've got some questions, just feel free to fire them over on the social. We're on all Facebook, Twitter, Instagram. Just drop us a message and I'm happy to kind of have a chat and give you some advice and things like that. I love doing it, so happy to kind of do it.
No, that's really appreciated. Thank you for your time, Kaz.
Lovely stuff. See you later, Andy.